how I will be managing the PPT? Okay, so ये use कर. Respected Chief Guest, all the learned officers of Army, worthy audience, good morning to all. Today, I am highly thankful to the organizers for providing me the opportunity to present my first-hand experiences. So I won't be discussing here the data, I won't be discussing the academic part of substance abuse, what substance abuse is, what are its causes and what are its signs and symptoms, but rather I would discuss my experiences and some of the insights which might help the policymakers, the planners, that how we can make a difference in this field. On a lighter note, whenever we review the history of Kashmir, there is a mention of charas takyas, that down the line there were charas takyas and they were part of the Kashmiri culture. And those people, when they say कि कश्मीर में जो भी कोई फंक्शन होता था, पहली त्रामी उनको ही जाती थी और उनको ही बोला जाता था दुआ करने के लिए. But now, do we still have those charas takyas? To me, I'm working in Kashmir for last 14 years, no more. But we see charas consumers everywhere. We see this charas cultivation, whether it is a wild cultivation or it is an organized cultivation, taking a toll. And can we remove this hoarding? जो बीच में आ रहा है. Now after year 2016, when people would ask me कि आपके पास जो patients आते हैं वो किस तरह का ज़्यादा abuse करते हैं, my answer would have been charas का abuse करते हैं और medicinal opioids का इस्तेमाल करते हैं. But since 2016, we are seeing a huge shift in this whole consumption. Now this whole thing gets replaced by heroin, and I would say the amount of people, the number of people who are getting afflicted is so huge that it would be correctly to put it that we are having a heroin epidemic in Kashmir. Now, in 2008, in the morning I was realizing it, that the people at that time who were at the helm of affairs, and I would name the Brigadier Saxena, who was then the media advisor to J&K police. He had a huge role and a vision in 2008 that drug abuse is going to be a problem. And it was the effort by these people at the time to start a drug judicial service in 2008. And the difference what I am seeing then and now, when in 2008 there was a complete denial by every section of the society, be it civil society, be it officials, be it bureaucrats, be it politicians at the time. But now I am seeing a shift, that there is a mass acceptance of the problem. Yes, we all are accepting that this problem is. And in 2008 and 2022, I am seeing this shift and recognizing this shift. And this gives me a hope that we might definitely overcome this whole problem. Because acceptance is the first thing. This was an initial drug judicial center which was established in Police Control Room, Srinagar in 2008. Initially seeing it as a 3-bed capacity and then gradually seeing the demand and the capacities were increased. So what I would like to share is starting the services at that time was not a problem. Yes, because there was no acceptance and there was a lot of things where whatever initiatives were being taken and it was being labeled and named. So that was a challenge. Second, maintaining the neutrality of the services. Because personally when I take it, when I was asked that, okay, would you like to work in this field? The challenge was not about job security or about the salary and other things. The challenge was that taking this challenge and starting the service and maintaining the neutrality of the service. And advocacy in the society that let them accept that there is a substance abuse is a problem or it is going to be a problem, because yes, en masse we were in denial. Again, challenge was starting, everything started, I would say, without a plan, without a proper budget. It was just a few officials who were involved and who said, no, we will start it. And then adding on to the infrastructure and adding on to the expectations of the people and to the professionals involved with it, that was the challenge. And sustaining the service in 2010, 2014 and 2016. Because we all know what happened in 2010 in that when whole Kashmir was on boil. In 2014 when this whole facility was submerged, and in 2016 again there was a huge challenge that how to restart it again and how to sustain it. And out of this, all these efforts from 2008 to present day, 2022, number one, there was always a criticism that running a de-addiction facility in the police control room is a problem. There were a lot many people reporting that they have difficulties, and the name, it was Police Drug De-Addiction Center. So there was a general perception that we need to be an addict and to visit the center. And this whole name has been changed from De-Addiction Center to Youth Development and Rehabilitation Center. From police control room, it has been shifted to the Eidgah area, where it has a huge campus, around 5 canals of land. And the infrastructure, yes, you can quote me, I tell you the infrastructure is without any parallel in the whole north of India. In terms of its capacities, in terms of the manpower for working there, in terms of their missionary zeal to work, yes, again I accept it here that the problem is we are not able to utilize this facility to its fullest capacity. We might discuss that in some separate slide. Now, what were our objectives? And have we really come forward to those objectives? Have we achieved them? The first objective was to help those youngsters who want to be treated, who want to be helped. And yes, still at this point of time, it holds true that the drug abusers, it has reached to an enormous proportion, and the available services is still a question mark. The second is to prevent all those people who are vulnerable to it. Are we, again at 2022, are we doing enough for it? Yes, I still see, yes, state has come up with a drug de-addiction policy or a drug addiction policy, but how much it is being executed on ground, there are questions. How much prevention programs we are running in our schools, in our society, in our communities, again a huge question to it, and lot many things need to be done on that front. To change the attitude of general population towards J&K police and reduce the gap. That was the subtle agenda at that time in 2008, and yes, if anybody asks me, I would say Police Drug De-Addiction Center have a survey. It is still considered to be the most preferred treatment facility for the general mass in Kashmir right now. Though we have facilities by Government Medical College Srinagar, we have facilities by some NGOs also, but still this facility is being preferred, not the reasons that something extraordinary is being done there, but I would take that privilege. Reasons are not those, reasons are simply to make it patient friendly. The reasons are more to make it family friendly. And I would say, whenever I deal with my counselors, whenever I deal with my professionals, I never encourage them to say to any person, affected person, that why you are using drugs, rather than to ask them what has led to the drug abuse, so that we give them the chance, we give them the space, so that they discuss their own narrative. Because here I would like to say that in Kashmir I am seeing different reasons for taking to the drugs. There can be one group who is for their novelty-seeking behavior, for their adventure-seeking behaviors. But there is a huge group who are there just to cope up with their personal problems, just to cope up what they have suffered in last 30 years of turmoil, just to cope up because of this ongoing problems. There are some direct consequences and there are some indirect consequences. The parenting has taken a hit. The parent-child relation, be it in our families or be it in our schools, there is a gap. And those people who are taking into drug abuse, out of those to cope up with their personal problems, to cope up with their family problems, to cope up whatever they are disturbed with. And I see that a huge population, and I don't see them as criminals. Now, some of the disturbing trends which I see during my work. Patients as young as 12 years of age getting affected. Young boys. And many times they have a different reason for taking to the drug abuse. Sometimes they say out of ignorance. A young boy doesn't have a confidence to talk to the teacher. A young boy who is infatuated with some relationship, and somebody misguides him that you take this thing and this will give you the confidence. Or sometimes taking the information from the social media and taking the cues from the social media or the modeling, taking the imitations by their peer groups, whatever they are doing. Now, many times people ask me, is this problem only limited to the Srinagar area? Or is it only the problem of rich? No. I see it across socio-occupational regions, I see it across rural urban regions, and I see it across socio-economic lines. These young users becoming school dropouts. And this is again my observation that this is the first thing which takes a hit, their continuation of the education, whether it is school, whether it is college. And yes, on date today, I'm saying that there is not a single effort being made in the whole area where somebody would come me, okay, how many young boys are there who have reported to you and who have discontinued their education, that we will make an effort to put them back to the education system. Easy access to all kinds of the drugs. Again, a huge problem here. Whenever, in fact, for last 6 to 7 months, it has become more complicated, more easily availability of the things. Whether it is chas, whether it is medicinal opioids, or whether it is this so-called heroin. How this becomes easily available, what are the networks involved to it, and in many times we have come to the incidents where it is being home supplied. Then I'm seeing certain features like what is related to the parenting. Again, when I talk about this denial, there was a mass denial by the society. Yes, today we are seeing a mass acceptance by the society. But when I talk to the individual parent, when I talk to the individual school authorities, I am still seeing them individually in denial. When I talk to a parent that I see your child having these behavioral issues, I don't see any explanation related to the mental illness, but there is only one thing which I am suspecting, that can be the substance abuse problem. And there is in just one knee-jerk response, कि मेरा बच्चा ऐसा नहीं कर सकता. And instead वो 10 पड़ोसियों के नाम देता है, वो 10 रिश्तेदारों के नाम गिनाता है, लेकिन अपनी प्रॉब्लम नहीं एक्सेप्ट कर रहा. So I think we need to work in this section so that every person takes it. Let's have a question. And what I used to say in all the platforms, कि अगर मेरे पड़ोस का बच्चा ड्रग अब्यूज़ कर रहा है, अगर मेरे पड़ोस में कोई बच्चा ड्रग अब्यूज़ कर रहा है, मैं सवाल पूछना चाहता हूँ उस पेरेंट से, आपके बच्चे में क्या ऐसा मैकेनिज्म है जिससे वो बच सकता है? क्या उसके पास मोबाइल फ़ोन नहीं है? क्या उसके पास पॉकेट मनी नहीं है? क्या उसके पास सोर्सेज नहीं? Then yes, shrinking spaces, physical activities, shrinking social spaces, that's again a problem. And with the COVID-19, again it is my hunch to see it, because now we are going to school after 2 years. I have a hunch that how many first-time abusers will be there. Because in these 2 years, because this going to school was serving a protection. Children had a routine, they would come out in the morning, go to the school, come back, they had their other things to do. But during these 2 years, they have come more close to the society, they have come more close to the streets, and I'm pretty sure that we might have a huge chunk of population who might be the first-time abusers. Now, what can be the way forward? Again, I'm seeing that lot many people about establishing of drug de-addiction centers. Lot many general population demanding that there should be drug de-addiction center in Kupwara, Handwara, Anantnag and other things. My question is establishing of drug de-addiction centers a solution? And second, what we are seeing for last couple of months, that people dying due to overdose deaths. So that need of the hour is that we should have an emergency treatment centers exclusively dealing with the overdose deaths. So who can do it, how to do it, that's still a question. To establish a dedicated helpline for all those families who are suffering. Because not many times family knows that their child is doing it, they want to take him to the treatment facility, but the boy is not cooperating. So how to do it, again, that can be thought about. Then augmentation of the existing services. Now again, I'm seeing that lot many people thinking of opening a de-addiction center. Rather than having a mushrooming of the centers, it will be better if all of us will coordinate and have a few centers with fully equipped. Like currently, J&K Police is having 4 centers in Kashmir region, 5 centers in Jammu region. But yes, I would say if anybody asks me, I would say that J&K Police should concentrate on the Srinagar and the Jammu center to establish them fully. Or if tomorrow any other organization want to have a center, rather than having a small center, inadequate center, it will be better that if we collaborate and have an existing, add to the existing facility and make it better to the people. Then we see that there is a need to correct the public perceptions. Even when we talk about the drug abuse in Kashmir, you ask a general person, a common person, आपको क्या लगता है कौन फैलाता है? And the answer is army फैलाती, police फैलाती, agencies फैलाती. So how this perception is being there and what to do in order to correct this perception, yes, that needs to be looked into and that needs to be corrected. And again, whatever de-addiction centers we have right now, I would call them as whatever centers, I would call them as detoxification centers. Rather than what we need is, we need to have a rehab facilities where this population, because I'm seeing this population very talented, not criminal, just taking a drug abuse, but not involved with any other criminal activities. And still, again, which gives me a hope that when I talk to them, they have a discrepancy that कि वो कुछ गलत कर रहे हैं, वो कुछ गुनाह कर रहे हैं, वो कुछ गलत कर रहे हैं, वो अपनी फैमिली रूल्स के खिलाफ कर रहे हैं. That gives me a hope. And what we need to do is, rather than, yes, treating them, but at the same time, we need to give them the skill trainings, rather than certified skill training, so that their trainings are accepted outside J&K also. They have the opportunity to work and become productive members for this society, for this community, and for this part of the world. And yes, we need to work on the prevention programs, which we are lacking. We need not work in random. We need to have an organized programs where we can focus on the schools, where we can focus on the teachers. Teachers need to be trained how to identify the early symptoms of it, how to have a proper referral systems. Rather, I am encouraging that every school should have a drug de-addiction policy. Rather than labeling these children and putting them out of the school, just warning their parents that कि आपका बच्चा कुछ कर नहीं सकता है, we should have a policy so that we can include them, incorporate them, and help them to come reintegrate with the society. And yes, there is a huge requirement for strict enforcement. That how this heroin comes to this place. Yes, one thing is very clear. As of now, I don't know we have any heroin manufacturing units in Jammu and Kashmir. Where from it comes, and then how it reaches to a common person in the hub of the Lal Chowk, that needs to be looked into it, and that needs to be plugged. And screening for substance abusers, for, I would say, government jobs, for driving license, for any kind of thing, so that it serves as a deterrent. Because when I talk to a young person that tomorrow you are educated person, you are abusing this heroin, tomorrow you will be going for a job, he says, sir, वहाँ कोई इसका नहीं पूछता है, वहाँ सिर्फ वो देखते हैं कि उसको हाथ पैर बराबर है, तो that's the only thing. And nobody thinks that whether he can take a proper decision, whether he can think properly. Then this one thing is very personally very disturbing to me. Whenever I interacted with people across Jammu and Kashmir, I am seeing this trend there. Earlier they were cultivating church, but now this church cultivation being replaced by the opium cultivation. So we need to take it seriously that before it becomes an organized sector. And why those people are taking it, there are different explanations for it. One explanation is that we have suffered, these fruit farmers, they say that we have suffered huge losses in last 3 years. And there, I've seen that there is a conflict between the parent and the child. Parent encourages that let's rebuild this orchard. The child says let's cut all the trees and go for this opium cultivation. And this is a disturbing trend to me, and we need to take it seriously and look into it. So these are some of the visuals, how police officers, all the officers in command, they were serious with this, how much they were involved in building and developing this infrastructure and this service, and it is all because of their involvement that we are there today. Here I remember this lady, and I will end here. This lady, she came to my center in 2012. I first thought that she is an ordinary lady, and when she disclosed that I have come from the Ministry of Home Affairs, and I have seen all your work, and it was her feedback that we should, in all our missions, in all our programs, we should focus on institution building. We should focus on institutional building. We should have institutions, welfare institutions in place, so that we can address to the people their problems, and that can ultimately lead to the change. Thank you very much.